Folks, I'm here with the fabulous and amazing Dr. David Sack. David, how are you?
I'm terrific today. Thank you so much.
Excellent. Thank you so much for spending time with me. I have some questions for you.
Okay.
Please don't look.
I'm not going to look at the questions.
First question I have for you is, every now and then, I like to curl up with a nice glass of wine, listen to some oldies. Is this okay, or do you think I need help?
It's perfectly okay. Most people who don't have a problem with alcohol can have a glass of wine socially or in their house, listen to music, read a book. So it's very different to have your glass of wine if you don't have a problem than if you do.
Gotcha. How much is too much of anything?
I don't think it's the quantity that makes something too much. It's not like 4 glasses of wine are unequivocally worse than 3. I think it's what the effect is on that individual. People are going to sometimes overdo things. Nobody's going to get through life without overdoing something. For some people it'll be beer or wine, some people it'll be tennis, but they're going to overdo things. But I think that what really defines too much is when there's a consequence, when something bad happens as a result of it.
Absolutely. For instance, I was really into Beanie Babies. Do you remember Beanie Babies?
I do remember Beanie Babies.
Oh, it just kind of ruined my life, and I had to step back and say, this is too much.
So did it ruin your life because you couldn't get the ones you wanted, or did it ruin your life because they were always putting out more of them that you had to find?
Let's go to the next question here
All
I have
right.
for you. Now, some people say addicts are making choices, that it's as much of a disease as, say, obsessing over Ryan Gosling movies, right? What are some other misconceptions that folks have about addiction?
When people say addicts make bad choices, what they're really saying is that they're impulsive, that the choices they make don't take into account the consequences that are going to occur. And there are lots of ways that, as scientists, we can measure whether people are more impulsive who have addiction. And so we can tell that people who are prone to addiction have trouble stopping behaviors that are harmful for them, and they have trouble delaying reward. So they're much more impulsive. So it's not that they don't understand that there are consequences, is that they don't care, that they're so drawn to the reward that they can't stop themselves.
Like honey badgers. They don't care.
They don't care.
They really don't. So is this marijuana as helpful as Dr. Willie Nelson says it is?
Most of the health benefits that have been associated with marijuana are wildly, and I mean wildly, overstated. Just like many of the harms that have been associated with marijuana are also vastly overstated.
Interesting.
When we think about drugs, most of the time we say, well, you're either straight or you're stoned. But because pot stays in the body for such long periods of time, that person's pretty much continuously stoned. And so they don't even know they're high anymore. They're high or they're higher, And so the changes that occur are completely opaque to them. They have tremendous difficulty seeing these changes in them.
Is this safe to say it's like when my cats have too much catnip?
I've never been asked to treat a cat with an excessive catnip problem, but there is a solution for that. Their owner has to stop giving it to them because they can't give it to themselves. But
Oh, so it's my fault?
I'm afraid it is. Afraid it is. Gotta own it.
Now, let's say I'm an addict and I'm watching this video with us right now. What's something you can tell the addict who's watching this absolutely terrified of doing something about their addiction?
One of the questions they may want to ask themselves is, are there ways in which my life is better or worse when I use drugs? Because most of the time, the person who's using drugs feels giddy, they feel happy, they remember the pleasurable moments, and they tend to sort of block out the consequences.
Sure.
So they may block out the fact that they can't pay their rent, or they may block out the fact that they just got fired because they couldn't get up in time because they were partying all night. So part of what you have to want them to do is a sort of moment of reflection. If I were to sort of put it out there, what are the pluses and minuses about what I'm doing and how it's affecting me?
Dr. David Sack, thank you so much for being with us today.
Oh, it's been my pleasure to be here. Thank you so much for inviting me.
Now, please, don't be stupid. Go visit Dr. David Sack's blog on Addiction.com. Do it right now. Right now! As in now. Will you please just do it already? What's their problem?